Let's do a quick word association. Let me know which words immediately come to mind when I say physical health. Was it diet, exercise, well-being? Now, what comes to mind when I say mental health? Was it anxiety, depression, stress? How come when we say mental health, the first thing that often comes to mind are mental illnesses? What is the difference between mental health and mental illness? This week, I'm answering all that and more. This is the Dr. K Show. I'm Dr. Karthik Ramanan. I help ambitious individuals end self-criticism with tools and strategies to create optimal everyday mental health. So if you're new here and you need to silence that negative voice in your head to get out of your own way and achieve the health and the life that you know you deserve, I am here for you. I encourage you to hit that subscribe button right now. According to the American Psychiatric Association, mental illnesses are health conditions involving changes in emotion, thinking, or behavior, or a combination of these. Mental illnesses are associated with distress and/or problems functioning in social, work, or family activities. They go on to say that mental health involves effective functioning in daily activities, resulting in productive activities, work, school, caregiving, healthy relationships, ability to adapt to change and cope with adversity. Mental illness refers to collectively all the diagnosable mental disorders, health conditions involving significant changes in thinking, emotion, and/or behavior, distress and/or problems functioning in social, work, or family activities. Now, when they say diagnosable, they're referring to the Diagnostic and Statistical Manual of Psychiatric Disorders, or the DSM-5. This manual clearly outlines the various criteria required to be able to diagnose a patient with, say, generalized anxiety disorder. If you're getting value out of this so far, a like rating would greatly be appreciated. Does that mean mental health is purely the absence of mental illness? To me, no. True mental health is about resilience, fulfillment, joy, vulnerability. It's the ability to handle emotional storms, acknowledge them for what they are, and allow them to pass without wreaking havoc on your personal, social, or professional functions. Mental health is the ability to use your mind as a tool rather than allowing it to use you. Mental health is emotional health. Balanced health. To give you a quick background, my medical training is in naturopathic medicine with a focus on integrative mental health. What does that mean? Basically, I look at my patients as a whole person and examine current symptoms and medical conditions along with past medical history, social history, physical and mental health history, any history of trauma, along with labs and imaging to make a diagnosis and a medical treatment plan. So when I look at a patient who's dealing with anxiety or depression, for instance, I'm looking at everything I mentioned before and your nutrition, your sleep, your exercise, along with your psychological patterns and social relationships. To me, those 5 factors, when optimized, produce the quality of life that I call everyday mental health. I'll repeat those 5 pillars: your psychology, relationships, nutrition, sleep, and exercise. Which of those 5 pillars do you need to focus on the most? Let me know in the comments below. Now, between us, I don't like the term mental disorder. It implies that something is wrong with you. We all have our challenges. We have different flavors of challenges, different degrees of challenges. And just because somebody doesn't qualify for a mental disorder diagnosis as per the DSM-5 doesn't mean that they don't have mental health challenges to address. And just because somebody has a diagnosis doesn't mean that something is wrong with them. What if instead of considering our body is like a car that just breaks down over time, we instead considered that we have an incredible ability to self-heal? We have our immune system, clotting cascades, and countless hormonal mechanisms to keep our body in as close to homeostasis as possible. What if depression, for instance, was one of those balancing mechanisms? Well, it's been found that in a state of depression, a person's brain exhibits incredibly high neuroplasticity, meaning that their neurons are actually rewiring and reframing knowledge, lessons, and meaning about themselves and the world around them. To the outside, it may look like the person is withdrawn and depressed, but the body is intelligent and the brain is actually healing. It's adaptive physiology at its finest. So my point is this: whatever challenge you're facing, you're not broken. There is always hope. Your mental health is about living your best life, and you will. Be sure to tune in next Wednesday for another episode of the Dr. K Show, and while you wait for that episode, be sure to check out this video right here. Always remember, I believe in your greatness.